Now, the prevalence of stomach and intestinal ulcer disease is approximately 10% of the population, and acids, proton pump inhibitors, and antibiotics are routinely used to combat this malady and improve the quality of life. But there seems to be some confusion as to the causes of these painful and potentially deadly wounds that develop in our digestive systems. So we've invited Dr. Paulo to clear the air. Welcome back.
Hello, Michael.
Now, Paulo, let's dive into the idea of digestive system ulcers. What exactly are we talking about here?
All right, so they're called peptic ulcers as a general name, and they include stomach ulcers, ulcers of the initial part of the small intestine, which is called the duodenum, as well as ulcers in the esophagus from reflux that comes up. In the stomach, we call them gastric ulcers. And gastric ulcers are predominantly due to the fact that the mucus layer that coats the inside of the stomach is basically thinned out, and then the gastric acid that was above the mucus layer for the purposes of digesting food has access to the actual layer of the stomach.
Okay, so that protection mechanism
the wall
is
of the stomach,
diminished,
yes, yeah.
Right.
So that's in a nutshell the primary mechanism. And so, as you said, potentially deadly, so it can cause to bleeding, or rather it can lead to bleeding, and bleeding from ulcers is the primary reason for hospitalization in terms of upper gastrointestinal bleeding.
Right. So then you've basically got an open wound that's being affected by the acid that's drifting around in your stomach.
Yeah.
Now, over the last probably 200 years, the cause and the reasons for ulcers have evolved. The understanding has evolved. What are the current understanding around what is causing these ulcers?
All right, there are a number of reasons. In terms of lifestyle, for example, a high-fat diet, high consumption of alcohol, and that's a relative concept.
Yes.
What is high for you may not be high for somebody else. And then also smoking. So all of these increase the production of gastric acid, for example. So these would play a greater role in terms of reflux and causing ulcers in the esophagus. All right. Otherwise, in the stomach and even the duodenum, the primary causes have to do with the bacteria and the intake of non-steroidal anti-inflammatory drugs.
Okay.
So the bacteria is called Helicobacter pylori, or H. pylori for short. The finding that this bacteria is the cause of 80% of gastric ulcers was the subject of the Physiology Nobel Prize of 2005. Yeah, the bacteria was first detected in 1982. But basically what it does, it has cytotoxins, so it has substances that are toxic to the cells, but it contains enzymes that literally thin out, dissolve this mucus layer, so that it can get access to the cells as it were. And then within the cells, it affects the cells, causes cellular death, and therefore it causes the wound.
Okay.
All right. So that's in terms of the bacteria. It also produces a whole lot of free radicals, on that cellular surface. In terms of the non-steroidal anti-inflammatory drugs, so that's brufen, diclofenac, aspirin specifically is a huge problem. Aspirin is obviously an over-the-counter medication. Anybody can buy it for pain relieving. It is also widely used in cardiovascular patients.
Yes.
Low dose aspirin, anything from 75 to about 300, 325 milligrams. Whereas for pain relief, we're looking at 500 to 1,000 milligrams. Now, research shows that specifically in these cardiovascular patients, it actually increases the potential of bleeding by 60%.
Good heavens,
number one.
really? Sure.
It also has an effect on both the thinning out of the mucus layer, because there are substances called prostaglandins. They play a role in inflammation, but they also play a role in producing this mucus layer.
Okay.
So when you reduce the prostaglandins in order to reduce inflammation, which is what aspirin does, you're reducing prostaglandins that would be affecting the production of the mucus layer.
A bit of a knock-on effect.
Correct.
Yeah.
Moreover, the aspirin then gets into the actual cells of the lining of the stomach, because it's in what we call a non-ionized form. And when it does that, it causes the cellular walls to become permeable. So things can kind of get in and get out that shouldn't get in, neither come out. And that causes the death of these cells, and it promotes the wound again.
So Paulo, what are some of the lifestyle actions that we can take or prevent or avoid maybe in terms of preventing these ulcers from developing?
All right, so in terms of diet, fruit and vegetables are very important. As I said earlier, smoking should be stopped.
Yes.
Consumption of alcohol should be reduced, especially if there are ulcers. When it comes to H. pylori, it is estimated that 50% of the world's population has got what we call a chronic infection.
Okay.
But only about 10% actually develop an ulcer.
Yes.
All right. Now, this is just an estimate because not everybody with ulcers sees a doctor. Not everybody with an ulcer, has it examined.
Yes.
And actually detected. All right. So. Of course, the other things would be as well to try and if you know you've got H. pylori infection, it can be treated. There are antibiotic measures that are taken. There are specific treatments taken over 10, 14 days. There are different treatments, and some of them work better than others. Some include 3 drugs, others 4 drugs. One can find out if one has an H. pylori infection by doing a blood test, which tests for antibodies. Okay. So if your body has created weapons against the H. pylori, then you'd have the infection. Yes. You can also do a stool test, which tests for actually pieces of the bacteria, if you want to put it that way. We call it an antigen. That's what your immune system reacts against, recognizes it as being foreign. So those are the sort of the basic lifestyle guidelines. Yes.
Right. Now, Paulo, in the current pharmaceutical design journal, sulforaphane is noted to protect the gastrointestinal tract against H. pylori and NSAID-induced ulceration. So it's an interesting one because that's going to help us in this whole system. But first of all, let's understand, what is sulforaphane? All right.
Sulforaphane is a substance which does not exist as sulforaphane in nature. And that sounds a little weird. But so what happens is that in cruciferous vegetables, so that's broccoli, cauliflower, cabbage, and so on, all right, there is a substance called glucoraphanin. In the plant, it acts as an insect repellent. And also as an antibiotic for the plant.
Yes, yes.
Okay. And then there is an enzyme called myrosinase. They reside in separate little bags, if you want to imagine that, within the plant.
Okay.
When you chew raw broccoli, for example, you mix these 2 bags. When they are mixed, you produce sulforaphane.
Interesting. Okay. How does now sulforaphane act against H. pylori?
All right. So it acts via a number of mechanisms. So it reduces the inflammation within the digestive system. It also promotes the presence of antioxidant enzymes, all right, and that is through a pathway known as NRF2, okay. And then research shows that in terms of H. pylori, sulforaphane has an actual antibiotic effect on the bacteria, so it reduces the colonization, because the bacteria comes and colonizes. So what happens, because it's a chronic thing, obviously one's immune system is not able to do away with it entirely. So it remains a low-grade chronic. And then if there are certain triggers in place, it can then lead to ulceration.
Okay.
So that's how sulforaphane helps against the H. pylori.
Right. Now, Paulo, in terms of the NSAID pharmaceuticals that are also implicated in ulcers, how does sulforaphane act against those?
Well, the NSAIDs cause high levels of inflammation, as I said earlier, and also they cause the death of cells because they cause the cells to become permeable. And sulforaphane has been shown to act against, so we call it anti-apoptotic. So in other words, it stops that death of the cells, and it is an anti-inflammatory. All right. What we've got to remember there is that if one is taking aspirin, for example, on a regular basis, and aspirin is having its detrimental effect, and now take sulforaphane, hoping that you are going to somehow combat,
stop it.
That is not the best means of trying to solve this, because you're sort of doing bad with one thing and hoping that something else.
Fix it, rub it out afterwards.
It's almost like binge drinking every night and trying to take something for the liver in the morning.
Yes.